Myth number 4, natural infection could be beneficial to community health by building herd immunity. So here's an example of what natural herd immunity might look like. Before our measles vaccine was introduced in 1963, worldwide epidemics occurred every few years. These epidemics resulted in about 2.6 million trusted source deaths annually. The widespread use of vaccinations significantly decreased that number. So in 2018, it was estimated that only 142,000, it seems wrong to even say only there, but in proportion, 142,000 trusted source deaths from measles occurred. That's worldwide. So, a great question to ask some of these so-called medical professionals, or at least our Health and Human Services Secretary, which doesn't even claim to be a medical professional, that are promoting the benefits of natural herd immunity, ask them which 2.6 million, largely children, they would like to sacrifice in their effort to convince people that vaccines are so dangerous and that the diseases that these vaccines are preventing are not really that dangerous themselves. That's what natural herd immunity looks like. Here are the rates of measles severity and complications in the United States. And as most of us are aware, we are one of the richest countries as far as access to financial resources, as well as medical and scientific research and resources. So, hospitalizations, there's 1 out of every 4 measles cases are hospitalized. 1 per every 1,000 cases of measles develop encephalitis, which is inflammation of the brain, and that's what can often lead to death. And then death specifically 1 to 2 out of every 1,000 cases of measles. These are just in cases, period. These are not so these include healthy individuals. The majority of measles cases in children are healthy children. The only factor differing is their vaccination status. The fact that children are of the age that they have not been able to develop really strong immunity by the time they contract measles is usually the issue, not the fact that their immune systems are compromised by other diseases. So in 2024, 40% of people with measles were hospitalized. And that's a link. So you can look at that specific study for more details on what they were hospitalized for, ages, and other health status. More severe complications from measles include pneumonia, encephalitis, as previously stated, brain damage, and pregnancy complications. So something that always has to be remembered when people are quoting statistics as far as, and they would do this with COVID-19 as well, as far as deaths in the general population, and trying to convince people that it's better just to naturally get these diseases that are vaccine preventable. It's not just deaths that, as a parent, I'm concerned about. I also want to avoid my, 4, 5, 6-year-old from getting pneumonia, whether it requires hospitalization or not, certainly encephalitis and brain damage. Healthy adults and children are susceptible to the same complications. These, again, they are documented as not just complications for those who have pre-existing conditions or are otherwise ill or compromised. Now, this phenomena is something I found just in this research I had not heard before, but it is also well documented. This immune amnesia specific to measles. Measles can wipe out the body's memory of bacteria and viruses, which weakens your immune system, making you more likely to get sick from other diseases. And this effect, this amnesia, can last for, I think the average was like 2 to 3 years. So, meaning this is exactly the opposite of what the HHS secretary is claiming, that by getting measles, kids can be have a more robust immune response to other diseases down the road. And I think he cites pneumonia as one of them, but it's exactly the opposite. If you contract this immune amnesia, and again, here are your sources. You can look at specific data on the amount of the percentage of people that actually get measles that get diagnosed with this immune amnesia. This means that diseases that you have already developed antibodies for. So if kids had already gotten pneumonia, trying to think of some examples of other ones, they or maybe got vaccinated for something else, the measles amnesia sort of erases that. So during this period of time, this 2 to 3 year period of time, they are again just as susceptible to those diseases as they were before they developed those antibodies. It's like they wipe out the immune system's memory of those antibodies, which is a little crazy. Let's talk about effectiveness of this MMR vax. So prevented about 90 million deaths worldwide since 1974. I think in the United States, it came out around in the 60s. So since 1974, 94 million deaths, prevented about 57 million deaths worldwide since 2000. Prevented 29,500 deaths in the United States since 1965, since it was like completely rolled out. And anywhere from 41,000 to 56,000 deaths in India between 2010 and 2013. So in the pre-vax era, about 500 people, mostly children, obviously they're the ones that are susceptible to this, used to die in the United States each year with measles. And now, because most people are vaccinated and protected, they don't. So there's some easy math for you. I know just giving numbers isn't doesn't always convince, but I have all my sources at the end. If you're somebody who just doesn't believe that this will happen today again, this whole resurgence, if we stop vaccinating and protecting our kids, just remember what happened during the measles epidemic in the early 1990s. Now, I did not remember this. I was very much alive, but was not paying attention to anything outside my little bubble, obviously. So there was a drop in measles vaccination rates, and there were 55,622 cases of measles and 123 deaths in the United States between 89 and 91. And in that same time, because this is things that a lot of people will say, oh, the reasons why the death rates used to be high with measles is because they didn't have, proper hygiene, sanitation, healthcare. No, that they had all that during this period of time. When I went to look up the reasons behind this particular outbreak, it was largely in New York City. Reagan had cut some funds that were going out to states to help with the public health outreach, vaccinations. And so although it was centered in New York City, there was pockets in most major cities where the poorest people lived, and they relied on public health clinics for their kids' vaccinations. Vaccinations not being covered, they just stopped getting them vaccinated. There was an estimate in New York City at one point that as much as 50% of the children, the school-age children, had not received both of the measles vaccinations. So when that's how it starts, small communities that have historically not been vaccinated. For instance, the Texas outbreak right now, I think they are looking at a community of Mennonites, maybe, that, historically they're not getting vaccinated. They are always at risk. But part of what we do to protect them is the rest of us are vaccinated. So they are largely protected, just like in COVID, protecting the elderly. The rest of us get vaccinated and wear masks. So we don't put at risk the least among us and the most vulnerable. Remember how we used to feel that way back in biblical days? So what was happening is that there are still these pockets of people in big cities, and now they were exposing children that were unvaccinated. And then it was just spreading like wildfire through children. The hospitals, same idea as COVID, overcrowded. So what happened is that the local government decided to make this huge push for vaccinations. They included messages in Times Square, public buses. Apparently, even Michelangelo from Teenage Mutant Ninja Turtles was getting in on the action, like jumping out of sewers or something to get vaccinations. They were providing free shots at the park, beaches, concerts. This should sound familiar. The whole point being that vaccinations are it is so well founded what the benefits of vaccines are. And we can go back decades and decades and decades. People know what to do. Actual public health professionals and medical professionals and scientists, they know what to do with something like this. This was not this spike here. This wasn't a mystery. As soon as they saw the numbers climbing, they got together and figured out, okay, how do we get vaccinations up? And they made them free, and they went to places where people were, beaches and parks, and could easily access them. And then guess what happened? It dove back down as vaccination rates went up. And I'm sure there's still those of you who just decided that not only can the CDC data not be trusted, even though the CDC has been around through many, many presidents and has demonstrated the same trend of results with vaccinations, and how as vaccinations go up, hospitalizations, actual diseases, the disease, hospitalizations as a result from the disease, and deaths as a result from the disease all start to plummet as vaccines go up, at least under the last 5 presidents. But if you want to claim that the CDC is politicized and they're just putting out data because it's, I don't know how they would benefit from that. Doctors that have dedicated their lives to helping eradicate diseases and keep us all safe. But if that's what you think they're doing, as well as reputable medical institutions like Johns Hopkins, Duke, NIH, if all the information has been fabricated by big pharma, then there's still more for you. Before the introduction of measles-containing vaccines in 1963 and mass vaccination efforts, measles was a leading cause of child mortality, with over 2 million deaths annually worldwide. So the data can obviously be much more dramatic when you look at the world as a whole. And because the world as a whole has more pockets of the underfunded areas, the obviously lower income, where they are largely relying on us and other rich countries in the world to provide them with vaccinations. So the World Health Organization expanded the program on immunization, launched in 1974, targeted measles among other diseases, leading to a dramatic decline in cases and deaths. In 2022, there was only 127 cases of measles and no deaths were reported by 15 out of 30 of the member states of the World Health Organization, representing a 99% decrease compared to just 2018. That's successful public health. That saves us all money. It's not just like that if you don't care about children, dying in India or whatever, but if you only care about yourself and your own country, this affects us. It's people traveling into our country when we are highly unvaccinated or continuing to grow into a more unvaccinated society. That's where we get it. That's where our people get sick. That's when our health system gets stressed, like in COVID. Steady decline in measles cases from 2000 to 2021 worldwide as efforts increased to provide children with 2 doses of the vaccination. This is just so, all the charts look like this. This graph represents measles deaths in Europe pre and post intro to the vaccination. And again, you can virtually find a graph that looks very similar from Australia, Canada, and Asia. These graphs will also look very similar to the ones in all of the other countries of the world that could afford vaccinations and pushed strongly to get them out and to promote how effective they were. This is what the graphs look like for smallpox, for polio, and yes, even COVID-19 vaccines. Highly effective at definitely still decreasing the amount of cases, but the primary goal of it is to keep people out of the hospital and dying. So if you are among those that honestly think that not only our country's medical institutions, CDC, all major universities, and medical scientists and professionals are in a big conspiracy to skew the data somehow, again, for some reason, to make money off of vaccines, maybe, which just aren't, I'm not even getting into that. But then you would also have to believe that all the countries of the world and their scientists and medical professionals are in on the same conspiracy because they all show the same data. I mean, listen to yourselves. That sounds crazy. That's crazy. If that's really what you think, you're also probably not watching this. And you definitely have more serious issues to contend with than being an anti-vaxxer. I am just so flummoxed at that whole line of thought. Where does that go? Where does that train lead? That's crazy. Thanks to vaccinations, this is a statement from UNICEF executive director. Thanks to vaccinations, more children now survive and thrive past their 5th birthday than at any other point in history. This massive achievement is a credit to the collective efforts of government partners, scientists, healthcare workers, civil society volunteers, and parents themselves, all pulling in the same direction of keeping our children safe from deadly diseases. We must build on this momentum and ensure that every child, everywhere, has access to life-saving immunizations. So I'm including my sources here, and I want to offer something on sources as far as these conspiracy theories go and how they get started and how they get perpetuated. Just let's try to be a more responsible source checker before just like screenshotting that first post I showed you with those different wonky vaccine schedules from different years. Like, if something looks like you're so excited to share it with everybody because it proves your point, just take a hot minute to just, I don't know, use the Google machine. Like, do not share things if your only source is a social media post or a Joe Rogan podcast. I don't care how much you love him. I don't care. He is not a scientist. He is not at all involved in medicine. Just look for actual sources. If you cannot find a reputable source that is not your favorite cable news anchor, don't share it. Like, the amount of time this took me to put together, and I am somebody who like lives and breathes science. Like, I'm always needing, like I said, looking up stuff for different presentations I do, looking up stuff for my patients and their caregivers. I'm always having to prove myself. Nobody believes anything I say, but that's good. We're used to having to show our work. Everybody should have to show their work now. Just stop taking the easy way out. Don't take a environmental lawyer's point of view and opinion on vaccines. A person can be considered an actual expert if you're looking to pass along something. Look for things that are validated by experts. An actual expert, if they have studied in this respective field, have spoken and written on the respective topic for longer than the majority of their peers, meaning they are probably highly respected by the majority of their peers. They're not having their peers or scientists and actual medical experts coming out and saying that, and discrediting them, saying that they are an embarrassment. Maybe don't share things from that person, that their medical school that they graduated from is telling us that, no, we have distanced ourselves from this person that is saying that COVID vaccines are dangerous. And yes, okay, this is the last thing that I was going to say. In all like fairness, as parents, I get it. We all are trying to make decisions about what is safe for our kids. I don't believe any parents out there trying to harm their children. But when you really think about it, this is what I sort of came down to. All of our decisions that we have to make for their safety are risk versus benefit analysis. It really all is that. When we decide to allow them, are they going to go to daycare versus staying home? There's finances, but they're going to be exposed to all these different things. Are they going to ride the bus versus me taking them to school? They're going to be exposed to bullying, horrible language, other, behavioral problems of other kids we can't control. It's all risk versus benefit, guys. Like, we all know this as parents. So when you decide to not vaccinate your child, you have got to look at all of the data, not just your favorite social media influencers and personalities, celebrity personalities. Look at people that do this for a living. Look at people that have done this successfully. There are going to always be claims out there. Anecdotal evidence is what it's called, largely, about what has happened to people after they received a vaccine. Nicki Minaj's, I don't know, cousin's brother, I don't remember, the swollen testicles after a COVID vaccination. Like, you're going to have that stuff all the time. But here's one thing key to remember. The more a sample size grows, so when I say sample size, like in a study, the more people get vaccinated, the more you're going to have the same amount of, say, children who there's a certain percentage of children who are going to end up hospitalized with an odd blood disorder. I don't know right off the an odd blood disorder. Um, if you hear a story or you know somebody that this person got a vaccination and ended up in the hospital with this blah blah blah, first of all, you need to look at the time frame after the vaccination. It's well documented that most of these vaccinations, if like specifically the COVID one, mRNAs, if it's 2 weeks following a vaccination, that is very unlikely to be due to a vaccination. You can look that up. I'm not including that in this one, but so look at the time frame afterwards, and then you just have to understand, statistically speaking, those same medical complications, heart attacks, strokes that were naturally going to occur in our population, and deaths that were naturally going to occur in our population are still going to occur to people who got vaccinated, because hopefully, like when our population was close to being 95% vaccinated for measles, we had no measles, we had no hospitalizations, we had no deaths from it. But 95% of the people got vaccinated. So out of those people, you're going to have deaths from other things. You're going to have medical complications. But you have to remove yourself a little bit from needing to look at everything as, oh, were they vaccinated? Oh, well, there you go. Like, scientifically speaking, the larger a sample population is, you're going to have those same medical events that occur. So what you have to look at is, after vaccination occurred, did this incident of strokes, heart attacks, blood clots, all these things, did they actually go up? Or were they the same in this vaccinated population as they were in the general population? So please, 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 careful about drawing that causation. Just because B followed A does not mean that A caused B. That is a huge error in logic that I see in many social posts gone viral. In summary, and I swear this is an actual summary, because as you may be able to hear in my voice over the what seems like years that I've been working on this presentation, I have developed a cold. And yes, I tested for COVID and it's not. But to wrap it up, we as parents do have many difficult decisions to make. And sometimes not all the data is there for us to make these decisions and weigh our risks versus benefits. But vaccinations is just not one of those areas. No matter how you feel about them, no matter what the source of your conspiracy theory is, there is tons of data built over decades of hardworking scientists that are really not paid that much. Medical professionals, this is rock solid data. So it's there for us if you choose to use it. And hopefully, this presentation at least could provide you with sources and areas that you can go back and check in the links I provided for yourself, because I certainly don't expect for you just to believe a doctor of physical therapy. But I did want to, like I said, show my work, provide sources, and give a little context and history about why I feel so adamant about these things and why there's absolutely no reason for children to be dying in our country over of a disease that we eradicated. That's going backwards, and there's no reason for us to go back.